So, good evening, everyone, and thank you so much for taking time out today on this evening. And we are very pleased to welcome Dr. Gaurav Chhaya, who is a very eminent name in the field of diabetes from Ahmedabad, and he's taken out time to join us today to talk about a very, very important topic, right? We all keep talking about doctor-patient communication. We read about a lot about it in various studies which talk about how patients sometimes are distressed because they feel that they've not been communicated well. And while there are a lot of things we do within the clinic to make them comfortable, understand them, be empathetic, and all of those general rules that we follow, that is some part of communication which we would also want to do beyond the clinic. And we know that technology today is really coming up and picking up in a big way. And if we take the help and support of this technology, we can probably enhance this doctor-patient communication as well. So with that, I hand it over to Dr. Gaurav Chhaya.
Thank you, Fitofly team, for inviting me on this particular talk session. And we will be discussing rather than giving a just simple talk about beyond the clinic and how we can enhance doctor-patient communication. So we'll start one by one. So initially, I'll just brief about what I'm going to discuss in future of our further times. So why it is important to have an effective communication? Because it leads to successful treatment, it leads to the betterment of the outcome of our patients, and it always informs us about how the patient is going to respond to our treatment plan. So it's always beneficial if we provide proper guidance in terms of communication, in terms of how to take the medicine, in terms of how to check your sugar, when to check, where to inform, where to go ahead. So all those things will lead to better identifications of the patient needs, and there are various facilitations of comprehensions of medical information, and the patients are more likely to be satisfied with care. Eventually, all this will lead to a good and successful treatment plan. Next. So there are various challenges in building the effective doctor-patient communication. The reason is there are the most important part is time constraint. A doctor has limited time to provide to the patient. There are n number of queues behind him. So doctors in only 3 countries like Sweden, USA, and Bulgaria can provide more than 20 minutes consultation time to our patients. We in India are usually giving sometimes 2 minutes to 10 minutes. So many physicians are just giving 2 minutes time. And in these 2 minutes, we can never achieve goal of proper doctor-patient communication and proper explanation. And there is always a complex medical jargon. In our Indian patients, they don't understand various technical aspects. And they are usually not techno-savvy in so many times. So they find difficult to understand the these complex medical jargons, and emotional and psychological factors like patient may experience fear, anxiety, stress while coming to our medical issues, and which eventually reduces their ability to communicate effectively, and they don't properly inform. So so many times they are so much shy about their information part. They don't even let the doctor know about minute of things which are more important for doctors but might not be possible to inform to a doctor by a patient's overall concerns. So there are various technologies available which can improve our doctor-patient communication with a healthy communication. And we all know about newer communication modalities like WhatsApp, chat bots, or all other various platforms which are available to now, and patients are using those. And the latest in of all this is a chat GPT. We all know this is a newer aspect where a guided doctor information tours are being given, and this particular equipment is an AI enabled equipment which gives physician the all the information at one click, and eventually that saves the time, and we can provide all those written or printed materials to the patient in just a few times. We all know about CGMS devices which are now connecting to our simple mobile. So through that mobile connectivity, the patients can inform us about the sugar data, what they are facing, and through our basically these connected devices. And there are various health information portals like Petrofly and all other which are available, and their apps are available which provides proper information to patients. Then post consultation monitoring can be done, and EMR usages which can improve our tracking of patient progress and how it improves. So we are now having various glucose monitor devices with this particular lead tracking device where they provide us a flow of overall a week or 2 weeks time. And as I said, powered chatbots, like they resolve our doubts or patient's doubt at one click, and they are almost 90% accurate. And this was not from my side. Various international studies are also now telling that this particular chatbots, if we use for information provision, they are usually good for patients, and they can provide us in a crispier way as compared to the previous past. Next slide. So what we know about various health apps and facilitations, communication, because there are various things and online portals are available, which the if patient uses, then they can maintain medical records, they can log the food diary, they can maintain health profile, then they assess a health blog and exercise videos on a regular note, and various recipes, how to have a healthy eating and how to have a good healthy food, and we can resolve the doubts through the of question and answers. Next slide. And we are all knowing that the previously we were talking about Google Doctor, but we are also having various apps available on app stores as well as Google Play stores. And the latest came is GPT, which is artificial intelligence doctor, which provides us all information on various platforms through a doctor's part. And the latest survey by Statista, which pointed out that there are almost 54,546 healthcare and medical apps available on various Google Play stores till December 2023. So, n number of resources are available. Next slide. And similarly, on App Store also, we have almost 41,000. So, large number of app stores. So, what to choose, how to choose, why not to choose. So, similarly, this is again one of the program for weight loss and diabetes care app, which was run by Fitterfly, and it is still there. And what they provide, like 4.3 rating on Google, with more than 1 lakh individuals use this day. And what they provide is members can even pair Fitterfly with Abbott Freestyle Libre sensor, then AccuCheck instant glucometers, Omron BP machines, then Google Fitness Tracker and Fitbits. All this can be actually attached to this particular. Then, as I said, this is AI-driven chatbot, and they provide various recipes, videos, trackers, and they provide consultations on a need base to our patients. So the patient can improve their wellness through not only physically but psychological also. Next slide. And there are various secure messaging and communication platforms like WhatsApp, Telegram, Facebook Messengers, and Signal, which are popularly available. And we all know that we are nowadays using WhatsApp to let our patient inform us their sugar values on routine basis. By providing their sugar values, they can be given the next day's insulin programs, and we can definitely manage their sugar values very well. This was very much helpful, particularly WhatsApp messaging system during the time of COVID, and we all have enjoyed that particular for providing distant these consultations to so many patients. So now these channels are becoming more confidential, more asynchronous, so that communication between doctor and patient can be encrypted throughout the days. Next slide. So as I talked about chat GPTs, various social, and these are the EMRs which are now being used by various patients, which can help us to track the patient's progresses. And the patient can also have certain use of EMRs, while we can have a comprehensive documentation. EMRs enable us to document our day in, day out things. We can have their sugar levels and all other medical diagnosis, treatment, medication at one go. So by one click, we can have their full data on our screen, and we can eventually adjust the requirement of the dosages on. We can have a centralized digital format. So it's easy to manage. Then various clinical decision can be supported through this particular thing. Like these drugs are variously having side effects, or this requires certain practices to be done, and so and so forth. Algorithms can be shared through this particular clinical decision support, and we can definitely communicate and collaborate various needs for the patient, like what care he's supposed to take, what collaboration he's supposed to take, when to call us back, and what are the problematic signs and all things in our day-to-day life. So it can become a multidisciplinary care, and it can coordinate all the patient needs at one go and one click. Next slide. And we all are knowing one important thing, that this EMR usages are supposed to be increased in our day-to-day life after this newer initiative of our government of India, which pro, like ABHA registry, which provides us to provide all the details of patient and to keep their health records at one central station. So we can improve outcome measurement, and we can see what the various improvement levels are there through this particular EMR facilitation, and we can monitor the patient throughout. And there are various patient engagement and empowerment programs are also being run into this particular EMR, which can eventually empower the patient to actively engage in their healthcare management and take their own progresses. Next slide. So there are various live sessions on social media which can bolster the communication. Like a doctor is expressing about what care he's supposed to take, what healthcare education and awareness can the patient need. So the need-based healthcare educations are now available on YouTube and various other platforms which we can use. We can share this type of engagement and interactions to our patients, and we can improve the community building and support through live sessions on social media, particularly various YouTube or other even-minded platforms. So, thus, various social media platforms also can help us to improve the patient's day-to-day requirement and day-to-day knowledge about particular diseases. Next slide. And we all are now using this AI-powered chatbot for resolving our doubts. And that chatbots are all fed with various question and answers. They having various diabetes care, harnesses natural, all other things are being actually fed to this. And when we ask them, or when patient may use these chatbots, then there will be doubt resolution, food recommendation charts can be provided, meal analysis can be provided through this chatbot, and gamification through the quizzes and all will improve the patient's actually involvement into our healthcare part. And this is what is the latest thing in our line, where we have various chatbots available. Next slide. So like one of these is JEDI. So Fitterfly has such power boards where an acronym of jovial and empathetic disease intelligence, where the members use this chatbot can provide 24 by 7 health advices, personalized healthy meal provided, then recommendation based profile, meal analysis been done, and various customized exercise sessions and such were done, engagement by playing the health quizzes are also been increased, and this was actually been started in December 2023. So this is again a good initiative which can definitely improve our patients' day-to-day life and our patients' overall health in by their active participation into the doctor-patient communication era. Next slide. So over here, I'll just thank you all, and I'll keep this session open for various questions, and we'll discuss about what various chatbots or what various such initiatives we people are using. So over to you.
So thank you so much for that presentation. I think that sets the tone right for people and will help them discuss. I had a couple of points, in mind when we talk about these, right? I appreciated the way probably chatbots give an answer and do that. We sometimes see there is always a trust deficit within the medical community when people are asking GPT or asking any bots and things like that. So how do we balance that out, the trust issue within the medical community also, and then also sometimes patients ask us that we got this kind of information through the bot, and this is what you had told us, so this is probably different, or this is explaining more in a very western concept or things like that. How do we overcome such challenges?
See, the chatbots and all are being actually meant for Western population more, and so they are providing informations for their or westernized method. We can generate our own Indian chatbot. We can generate our own data bank, which eventually provides what we used to talk to our patients. And this is where we can definitely, first thing as a doctor, we can reduce this conflict of interests. And secondly, usually what we tell them that these are the newer things. There might be some 9, 5, 10% plus minuses are there. So whatever we as a doctor are informing you should be taken care at most at max. And these are all additional guidelines. So you can go ahead with it also if you are comfortable with. So by such approach, like balancing thing, that these are all westernized things. So we are still in the development phase. Like for Indians, we are now generating such data. We are generating chatbots. So like Indian chatbots will come, then there won't be any such issues in future.
Right. I think that whole regionalism and the entire thing for our food databases, our entire lifestyle, and if all that can be incorporated with our whole practices within India, I
Yeah.
think that will a great thing to do. Uh, Two is also around, when we talk about beyond the clinic communication, sometimes as doctors, we are skeptical that, we are opening channels a little too much, and, social media and all those places. And then a lot of times we feel that patients, keep probably asking a lot of doubts on WhatsApp and those things. And there are a lot of legalities also associated with telemedicine, consultation, and all those ideas. So, any tips and tricks for that? How do we handle WhatsApp based prescription or calls or those ideas?
See, in a clinical aspect, telemedicine is allowed only by getting consent, and WhatsApp don't provide that consent. So WhatsApp is for follow-up guidance
Okay.
with the small things. We can, yes, like if I'm using certain for platforms EMRs, which provides me to or helps me to provide uh, telephonic consultations. There, what they find, they always write that this has a limitation and done by the telephonic version. So there is limited basically value of this, and that is to be signed consented by patient. So such approach can reduce the patient's basically profile of just negating our overall aspects. And the most important part, we use this type of chats or this type of EMRs and everything just to keep track of our patient's well-being. If we are in doubt, always need to ask our patient to come to a clinic or to attend the nearest possible hospital. And this simple practice can definitely save the patient's life in future also, and overall it can definitely help the patients to achieve their health goals. And yes, the most important part what we can do is uh, WhatsApp are just for basic information, and this we can definitely like adjustment of dose of medication, just informing like suppose patient is getting hypoglycemia, then what I do, I reduce the dose. For that purpose, use WhatsApp, and then viewing the reports is good, and discussing about the reports through WhatsApp is I think proper. Otherwise, wherever we need one-to-one discussion or when we want to change various medications, naturally, I think it's better to go with a legal, legitimate way of taking any particular such approaches like calling to clinic or going through EMRs, which provides this online consultations. So in that way, in
Right.
my own clinic.
Right. No, I think very, very well said. If we are able to draw that line, this is what we can do on WhatsApp. This is what we want to do beyond. So you mentioned about EMRs, in these things, and how easy are, using those things? Are they able to save time? Because a lot of people sometimes have this inhibition that with the entire electronic system, you'll probably need an extra clinic to enter things in the system, or those printed things will come, there will probably be an error. A lot of people have that pen habit of things. So how has that adoption been of EMRs, and is it really easy to use? Is it simplifying your life, or is it making it more
See, there are
complex?
two types of EMRs available. One is offline, one is online. And both have almost simple interfaces. The only thing is your data is saved to cloud or your data is saved in your own computer. That's the only difference.
Yeah.
And the ease of using this EMRs are like doctors who are using it, they are using for last 10, 12, 15 years. And they are happy because all the data, all the pen paper things are now at our own dispersal. We have all the details of our patient with us. We don't need to add any more staff because we have our own nursing staff sitting outside who can help you in taking BP, height, weight, and all other data and can feed into your EMR. And once the patient comes in, you know all other things. So, like, it's not requiring time. On the contrary, it can save your time because the prescription which is generated is already there once you enter it, and then you need to just change it. So over a period of 5 or 7 minutes you can finish the job, and in a follow-up time, the first time you might require 10 to 12 minutes. It's okay, it's first time. And then each visit you require less number of time. You can have good talk about it. You can discuss about it. Oh, during that March 2023 when you came, you had so and so complaints that you know only through your EMR. You don't know, you don't remember, you cannot see the file all the time. But
Right.
just seeing one simple glimpse towards the screen can provide you this type of data. Like, okay, in March, the person who came had severe abdominal pain, or the similar type of treatment was given almost 8, 10 months back. So, such thing can help us improve the patient communication and
Right.
can help us improve the treatment plan, modality of action, and uh, and then we can have a good outcome because patient will feel confident. Okay, Dr. Gaurav is having all the knowledge about my current as well as previous diseases also. Good, it's good, and that
Right.
way you can definitely help your patient, and you can have a overall great results.
Right. I think helps in building trust, and the point
Yes,
that the doctor remembers every smaller detail, though of course through an electronic media, but that
whatever.
thought of remembering everything and knowing all my small details definitely has an impact in building that bond with the patient and will eventually, of course, impact their outcome and goal. Uh, Another point we spoke about is about CGM, as a technology, and there are points where sometimes we feel it is overutilized in certain places where we also see a lot of non-diabetics using it, people using it, for weight loss, some nutritionists prescribing it, etc. And at the same time, we also see a lot of underutilization where patients who genuinely need to use devices and technology like that are probably not using it. So, how do we balance that out? What is the right population that you think needs a CGM device in diabetes practice, and where we should draw the line that, okay, you don't need one? Sometimes patients are enthusiastic with all these ads and everything they see that we want a device. And sometimes where you push that, no, you need the device, you must take it. So, please help us with that.
Yeah, CGM is definitely nowadays very important tool because in current era, what we are talking about is time in range, TIR, and it is one of the most important health factor talked about in our diabetes conferences. So all diabetics should have at least once or twice got their CGM done in their life. But I'll say yes, overutilization by various dietitians and various other aspects should be prohibited as far as possible because the GMS is not going to give you any extra additional information for weight loss reduction. No, it's not supposed to be used there. But this particular part, CGM, is useful when a patient is taking insulin on multiple time, could not check, or on oral medications, and could not understand what actually is disturbing the patient's value, where A1C either is 7 or 8, but fasting ppb lower, or a fasting ppbs is normal and A1C is high, or reverse, vice versa, is normal and fasting ppbs is high. So what is correct in such patient scenario? We must always ask for CGM, which is now not that dearer, and it can now be tracked by the mobile facilities also. So I'll say, in nutshell, all diabetics who are on insulin must get their CGM done for initiation as well as continuation of this particular treatment plan, future development, and all receiving patients who are having very high or very low sugar levels or recurrent hypoglycemia must be given CGMs.
I think we have a question from the audience as well, who's asking about names of EMRs, which are any EMRs that you know are legally valid or approved with the feature of patient consent.
Hmm. It's a good question. I have a couple of them where they provide, where they have given you the actually this facility of taking consent. One which I used is HealthPix EMR, and two more are there which I never used. I knew about them, uh, which provide this type of consent from patient and at the time of teleconsultation. Uh, Unluckily, they are not nowadays in this our circulation, so we could not find them easily. But HealthPlex is at present available, and which can help you assist this particular consent part and can do the consultation online. The other few like are there, like Visual Soft, which is just for a local EMR, which is not an online EMR. Then various then Top Dog EMR is there, and there are even various other EMRs like are available. But best of them till that is one I used a couple of times is EMRY. Uh, this particularly uh, HealthPlex.
That solves this doubt, I hope. And If there are any more questions for Dr. Gada, we have him for a couple of more minutes in case anybody from the audience would like to ask any question or would like to clarify any doubts regarding this topic. So Dr. Vijay asks you if there is any I presume is what he means instead of fee EMR that you suggest for regular clinical practice.
I think I'll say one thing, Dr. Vijay, that the EMR which is easily available service provided in your area must be used by you. I use one, you must use another, because all EMRs are not equally available to all areas.
Okay.
But if you are comfortable with, you can, as I said, I had used Fitter, particularly HealthPlex. I had used VisualSoft EMR. Also, I used during the time of COVID couple of more uh, uh, like TopDoc AI and various other things. At the time of COVID, I used it, but then as it was COVID, it was used, and eventually, I think we cannot have too many EMRs available to us. So the available part and the better serviceable part must be used.
Thank you. We have another question from Dr. Jyoti. Was how well is chatbot used in India at present? And is there any application that you suggest to your patients?
Sorry, I cannot provide you any application for this particular service. But to be very frank with you, doctors like us are nowadays using chatbots to provide various informations to uh, clear the paperwork of ours, and to know about various side effects of various drugs, as well as what are the various means and ways of treating our patient. We can come to know through such chatbots. Uh, I had used one, ChatGPT, and the rest are others are there. And this ChatGPT is just a GPT which provides me various information on our health system, as well as what various legal contracts to be done, how you can write a surgery note, how you can go ahead with a particular note, and such and so forth. You can know these are available over the go, and you can definitely get some on.
We'll take these last two questions and call it off. Fitterfly does not have an inbuilt EMR, Dr. Raju. Fitterfly can be integrated with EMRs. So if you have an EMR system, there can be an integration that can happen between the two. This one probably you can answer, Dr. Gaurav, around clinical decision support systems within EMRs if you have, or in general, do you use anything which tells you what to choose, what algorithm, any guideline based thing, or any clinical decision support tool that comes with the.
Yes, there are a few of them. They let you select your own like disease-wise treatment plans, and they can let you choose disease-wise investigation plans, and they provide you disease-wise uh, this advices to patient also, that what care he is supposed to take, what care he is not. So at present, these are primitive uses, is not going to the doctor's full and a formal role. But I think that's perfect, because they can let you choose what medicines you can use. If, like, I'm treating diabetes, and then as I write down diabetes mellitus type 2, then of its own it will provide me limepiride metformin, DPP4, SGLT2, so and so forth. What you want to prescribe, and then I need to select the dose and then finish the job. So such things we can get from such EMRs. So clinical decision making can be there, but I'll say just avoid overusing such, because we doctors are always bound to do the job and we need to always see through our human brains about all those side effects. Yes, we can definitely rely on the side effect profile. Like if a patient is being given SGLT2 and another drug, and they might mismatch, or a urinary tract infection you need to take care of while prescribing. Such things, yes, we can definitely use in our future life. And this type of EMRs are always there. In current future, I'm sure we will be definitely getting all those CDSS requiring, or all those CDSS providing EMRs.
Sure. I think very well said, and I think that's a good note to end also, that we need to use our own skills and the human intelligence over technology, and just use it probably as an aid, as a support, and continue the art of medicine the way it is. So thank you so much, Dr. Gaurav, for all your time and wonderful insights that you shared on doctor-patient communication and how we can enhance and improve and optimize time as well as communication with our patients. Also, thank the audience for keeping it so interactive. Uh, Thank you so much, everyone. Have a pleasant evening and a great weekend ahead. Thank
Thank
you.
you very much. Thank you very much. And to you people all who just managed all this very nicely. And all the attendees, I thank you for your interest, active interest. We can do such events in future also. And
Sure,
this motivates us to keep providing such things in future.
sure,
Yeah.
sure. Thank you so much, everyone.
Yeah. Bye bye.